Okay, so I'm going to go ahead and show you how to do a tube feeding using an NG tube. So, first of all, I'm going to check my order. My order happens to be Glucerna 240 with 100 water flush Q4 hours. So it's an intermittent tube feeding. So I'm going to gather all my equipment, my Glucerna, my piston syringe, an extra cup. I'm going to have my pH paper strips, maybe an emesis base and a towel. I come in the room, knock on the door, wash my hands as I walk in the door, identify myself. Hi, my name's Debbie. I'm going to be your nurse today. Can you tell me your name, your date of birth? I get his name and his date of birth. Do you have any allergies? Just like I always do. Okay. Then I'm going to have him up, lay him a little bit down in the bed. I'm going to check his abdomen because I'm going to do a tube feeding. I want to make sure his abdomen's okay, that he's actually able to, process what he's eating. So I look at the abdomen first. It looks flat. All right. So then I listen. Sounds in all four quadrants are present. And then I feel his abdomen is soft, non-distended. Ask him, do you have any nausea, any vomiting, anything like that? Just says, if it's okay for him to eat. Then I'm going to go ahead and put my gloves on and start checking to make sure that his tube is in place. First thing I want to do, again, like we talked about in class, you need to do multiple assessments of this because there's no one way that's perfect. As that article showed you, there's just really no one way that's perfect. So, go ahead and undo this. And the first thing I'm going to check is I'm going to check the nose. Has it moved at all? Or if I had a measurement, I would check, when I would put it in, I would check to see the measurement from here to here. Has that measurement changed? Because I want to see if he's pulled it out. I don't have a measurement at this facility, so I'm going to at least look to see if the marking on the nose is still at the same place. It doesn't look like it's moved. So that's check one. The next thing I want to do is I'm going to put a little air in here to clear that line just a little bit, because remember how I talked about it in the article again. And that just helps to clear that away from the stomach, especially if you can't pull up any pH, but also just clears a little bit. I'm not listening at this point. We don't listen. That's one of the things we don't do that Matheny talks about. So I cleared that up. Now I'm going to pull up to get gastric contents. And when I get those gastric contents, I look at those gastric contents. Check two. What do those gastric contents? Does it look like gastric contents, or does it look like it's mucus? So it looks kind of grassy green. Looks like stomach contents to me. So I'm crimping this. And I'm going to put just a tiny bit of those gastric contents on a pH strip. Just a tiny bit. Just that on here, set that down. And I'm going to check my pH strip. Hold it up against my pH paper. And I want that to read 5.5 or less. So it happens to read 3 today. Wonderful, great. So now I've gotten my checks. I've done as many checks as I can. If there was any doubt at all, you have to, get an order. They'll probably send them for X-ray. But at this point, it looks like I think that it's in place. It hasn't moved. It looks like stomach contents is pulled out. The pH was correct. So now I'm going to make sure that there's not a lot of residual in the stomach. Before I feed him, I don't want there to be a lot of residual. Again, that's a controversial area. The book talks about 2 different amounts in the book. So I'm going to give you a kind of medium number. So at this facility, the policy is if it goes above 200, to hold it. So if it's 200 or above, so I have to pull back the residual, and it goes to 50. So I take that residual and I put that back in where all those electrolytes and stomach acids are. I want him to keep those to help to digest. If it went past 60, I would put that in the cup, go back and get until I cannot get any more. So that's why I have this extra cup here. All the equipment, by the way, is only good for 24 hours. So I put that, like I said, that extra 50 back in. Now there's a bunch of stuff in here, tube feeding, residual, there's stomach contents. So I want to clear that out before I give him his tube feed. So I crimped that before I took that cap off. Put the cap on, so before I took the syringe on. And now I'm going to clear it with 30 mLs of water. This is just a clean procedure, it's not sterile. But I do need clean gloves on to protect myself. So I pull it up to 30, and I'm going to crimp this again, take the cap off, and flush it with 30 of water. I take my syringe back off, to crimp it again, put my cap back on. Now I'm going to get ready to feed. So I get my ordered solution, my Glucerna. I check to make sure the expiration date is good on it. Make sure I have the correct tubing formula. I shake it up and I take an alcohol swab and I clean the top before I open it. I pop it open. It says 237 on this can. I need 240. That's okay. It doesn't have to be exact. It's not like medicine, so it's 240. All right. So I'm going to give this by syringe feeding. At this facility is okay. Some facilities, they make you do gravity bag. On some facilities, actually make you a pump, if it's ordered by pump, I should say. Some facilities, like I said, it might be gravity bag, which I'll show you in a minute. So this is a syringe feeding. So I hold this, I crimp this, I take the inner part of the syringe out. Take my cap off, and put this in. Now I'm ready to give my tube feed. So I pour it in, and I keep it a little bit about this level because in case he coughs, I don't want to spill over. And I go at a rate that is comfortable. I'm watching him, assessing him. It's comfortable for him, but I don't give it too fast. While I'm talking to him and assessing him, and I pour it in. I can give this whole can. Now let's say I only had 120 ordered. I couldn't just eyeball it. I do need to measure it out first. So let's say I go ahead and I give the whole can. I have an order for a 100 water flush. So I'm going to give my feeding by gravity as well as my flush by gravity. So I'm going to crimp this so that when I measure, it doesn't continue to pour down. So I'm going to, at this point, pour in 50 of water, and it stops because I have it crimped. Then I let this out, let the 50 run in, and then I give my other 50, to equal a total of 100. Let that run in. Take this off. Put my cap back on. Go ahead and hook this back up. This up. And I would tell him to go ahead and stay at least 30 degrees for the next hour. I want to clean my equipment up. This equipment is only good for 24 hours. So I clean my equipment up, wash everything up, and take my gloves off, wash my hands, and I go and record. I need to record all my I's and O's. I need to record the tube feeding that I gave. I need to record all my assessments, my abdominal, my pH, how much residual, all of that. So at that point, I do all my documentation. I wash my hands, all that, make sure he was safe in the bag, gave him his call light, all that. Let's say, however, I needed to give until instead of a syringe feeding, I needed to give it by a bag. So what would I do different? So I'd come in and do all the assessments. I still do my pH checks, my residual checks. Let's say I'm at the point though that I need to give the tube feeding. So I would have done my residual check and I would have flushed my 30 back in. So let's say, let me show you do that. So I've done my residual check. Already done my pH check, all that. So I come over here, got my residual, put it back in. Flush with 30 of water. Now, instead of doing a syringe feeding, I'm going to do it by gravity bag. So this bag is also good for 24 hours. Only so I would label it. Now the bag does look a little different than the one that's on the pump, but that's okay. I can still show you how it works. So I take my bag, label my bag, open this up the same way, clean it off, shake it, all that, check the expiration date. And then I pour my make sure my tubing is clamped. I rolling the roller. Open this up and pour it in. Look. Put the cap on. Open the roller clamp and let it go all the way down to the very end of the tubing. Because I don't want a bunch of air in this stuff. I hang it up. Take the cap off. Crimp this up again, just like I did before. Hook this into here. And then I just open this tubing up so that it goes over like a half hour. And just let it drain in. When it's almost done, I come back in and I'm going to do my water. So I fill my water up to 100. It's just tap water. And then when it's almost to the very end, I come over here and I put my water in my bag. And hang it up. And that cleans my bag out, the tubing out, as well as gives him his water bolus. So once it's done, I clamp this off. Clamp this, take this out, put my cap back on this. Put my cap back on this. And then reattach this. So that's how I get my gravity back. So let's say I didn't have an intermittent tube feeding, I had a continuous tube feeding. Continuous tube feeding, of course, is not going to have to be on a pump. So let's say it is going at 100 mils per hour is the order. How much is it? 100 mils per hour. So the pump would be set to 100. I still need to do checks. Check for residual, and I still need to check placement every 4 to 6 hours. Depending what's ordered, but usually, let's say it's every 4 hours. And maybe I have to even give a water flush, all right? So I come in, I'm going to do all the assessments that I made before. So, still gonna do the abdominal assessment, still gonna check the nose, still gonna check and pull back and make sure I have my, what the color of the gastric contents is, what the pH level is, and then I'm still gonna pull back residual. So how much, I gave you a number of 200 for the intermittent tubing, but what is the residual for if it's a continuous tube feeding? The book says 20% above the going rate. So that would be an awful lot for 200 if it's 20%, if it's only going at 100, or let's say it's only going at 50 an hour. 200 is either 4 times the amount, if it was 50, or 2 times the amount. And that seems a little bit much. So what does the book say? It's 20% above the going rate. So if it was 100 mils per hour, 20% above 100 is 20 mils, is 20%. So 20% above is 120. So if I come in and I check the residual and there's 150 in there, I'm going to put that residual back in, I'm going to flush it with 30 of water, turn the pump off for 1 hour. So what do I do then if it's too much? I come back in after an hour and I check the residual at that time. If the residual is below the 120, then I can go ahead and put that residual back in, flush the tubing with 30 of water, and then start my pump back up. So that's what I do if my residual is too high, is I wait 1 hour and then I come back after an hour, see if the residual is within the recommended amount. Sometimes it's doctor ordered, hold for residual of, sometimes it's policy. Okay, so if it's within the recommended amount, then I go ahead and give the tube feeding. Here's another scenario now. What if I have meds ordered? So let's say I have meds ordered for my patient. So how do I give meds per a tube? So first thing I want to do is I want to get my meds out, assemble them, according to my 7 rights. We do 3 checks in the room, in the nurse's station. So I would pull them out doing my 7 right, using my 7 rights. And I will ask you what those 7 rights are, the patient, time, the med, the dose, the route, the documentation, the reasons. So I bring my meds in, I come in, I want to identify my patient, name, date of birth, and allergies, of course. While I was in the nurse's station, if I had a pill, I crush it, by the way. I could keep it in a package so that I could scan it. I crush it, but I can only crush ones that are crushable. So how would I know for sure if it's crushable? I need to look it up. If it's not, if I can't find it in my drug book, I can call the pharmacist. You know for sure that you can't crush Terra coated, XL, XR, but sometimes you can't crush ones that are not labeled EC, XL, all that. So let's say I have it in and I have it crushed. I would need to bring in cups. Each we're going to give them separately. So what do I need to do for that? So I have 1 pill for this and 1 pill for that. Come in, identify my patient, provide privacy, all that other stuff. So at that point, I'm going to name, date of birth, allergy, scan my armband, scan my meds, do my 3rd check, and I'm ready to go. So I've got this crushed, and I pour it into each cup. Mix a little water in with this one because it's powder. I mix as much as I need, 15 to 30 mLs. Warm water, let it dissolve, and I pour this one into the cup, however much it needs. All right, so I have these 2 meds ready to go. So I'm going to do all the same things again. I'm going to assess my abdomen, all that. So then I check the nose. Can I put anything in until I've assessed? No, the only thing I can put in there is air. I can't put water, I can't put food, I can't put meds until I've assessed to make sure it's in place. So then I look at my nose. If I needed to, I could measure it. I'm gonna go ahead and put a little air in. Push that away from that wall. Wants to clear out anything. Okay. Now I'm gonna pull back a little bit of stomach contents. It looks like it's kind of greenish. I'm gonna go ahead and check the pH of that stomach contents. pH says it's 4. That's below my 5.5. I'm gonna go ahead and check my residual. It's 30. Push the residual back in. Go ahead and flush it to 30. Take this off. And just like I got ready to do my tube fitting, now I'm going to get ready to do my meds. I'm going to take the inner part of the syringe out. Hook it up. I've already flushed it, it's clean, it's been checked. So now I'm going to give my meds. So I gave my first med. I pour about 5 to 10 solution in between. Let that flow in. I give my second med. Pour 5 to 10 in between. All the way up until the end. Once I have gotten my last medication, which if I only had 2, it would be my second med, and then pour in at the very end, after my second med, I would pour it in 30, measure to 30, and then let it out, let it flow to clear that line. I want to make sure that line's clear because I don't want it to clog up. Put the cap back on, record all my medications, record how we tolerated it, record the I's and O's, record my placement checks, record any assessments I've made. And I'm done. So if this man had this to suction instead of to tube feeding, I would actually hold the suction for a half hour. Sometimes we actually are allowed to use the meds when they have use the tube to give meds when they actually are on suction. We have to have doctor's order for that, of course. But you would make sure that you would hold the suction for a half hour, otherwise you're just sucking that med back out. So if that's the case, make sure that you hold that suction for a half hour. I think that's all I need to